Operation Dudula in South Africa, xenophobia, healthcare crisis, and the truth behind overcrowded hospitals. Operation Dudula, a movement that calls itself patriotic, but many openly call it xenophobic, turning foreign nationals away from public clinics, chanting that they are taking our jobs and services. But has this actually saved the system, or has it cost lives? And is the real problem migrants, or a health system that's been failing for decades? Let's dig into what's really happening in South Africa and its public healthcare crisis. So who is Operation Dudula? It started in Soweto in 2021. Operation Dudula means push back. Their main claim is that foreign nationals, mostly Zimbabweans, Malawians, Mozambicans, and Nigerians, are overwhelming public services and taking jobs in South Africa. Members have blocked clinic entrances, demanding patients show IDs, and threatened healthcare workers who treat undocumented people. Leaders insist it's not about hate, but about taking back South Africa's limited resources. Has Operation Dudula led to deaths? South Africa's Human Rights Commission and Doctors Without Borders have documented cases where migrants, pregnant women, and even South African citizens without IDs were denied emergency care. In 2022, at least 3 reported cases where pregnant foreign women lost their babies were reported after being denied help in Gauteng and Limpopo. Human rights groups warn many more cases are likely going unreported because victims fear police and deportation. It should be noted that under South African law, emergency care must be provided to anyone, regardless of documentation. So are migrants really overcrowding the system? Let's look at the numbers. Estimates say foreign-born residents make up about 4 to 7% of South Africa's 60 million population. In hospitals, a 2020 study in Gauteng showed less than 6% of patients were non-citizens, far below the myth that half the patients are foreigners. Further, foreign nationals do use clinics, often because they live and work in South Africa. But there's no data proving that they're overwhelming the hospitals. Another fact to note is that South Africa's healthcare strain comes mainly from high demand, low staff numbers, poor management, and underfunding, not just migration. So what is the real crisis? It's underfunding and understaffing. South Africa spends about 8 to 9% of its GDP on healthcare, similar to middle-income countries. But the system is deeply unequal. Over 80% of the population relies on public hospitals, while only about 16% have private medical aid. Public hospitals face shortages of doctors, nurses, equipment, and medicine. Mismanagement and corruption scandals like the Life Esidimeni tragedy that killed 144 psychiatric patients show systemic failure beyond immigration. So will the system continue to fail? Unless government increases investment, improves training, and stops corruption, hospitals will stay overcrowded and under-resourced. South Africa is moving towards national health insurance to create universal coverage, but experts warn it needs massive funding and honest administration in order to work. Blaming migrants won't solve doctor shortages, old infrastructure, and medicine stockouts. The human cost of xenophobia. Turning people away from clinics isn't just illegal, it risks deadly outbreaks of tuberculosis, HIV, and even COVID that threaten everyone in the community. Health workers face impossible choices: treat everyone ethically or face intimidation by groups like Operation Dudula.
Africa belongs to South African. I hate foreigner. I hate Grikamba. I hate Kwara. I hate Zaizai. I don't like foreigner. Foreigner must go to their country. I hate foreigners. I am xenophobic. I hate, again, I hate times and times. I don't know how many times. I hate foreigners. I am xenophobic. I don't like foreigner because foreigners, I don't have a child because of foreigner. Ramaphosa, take these foreigners to their country. Right?
Hate spreads. After Dudula's rise, there have been more community attacks on small businesses owned by foreigners. So, Operation Dudula's slogans may sound simple, like send them home, but the data shows that the real enemy isn't poor migrants. It's inequality, corruption, and underfunding. Until South Africa fixes those, the crisis will continue, no matter who gets turned away at the clinic door.
And welcome to my channel. Thank you for giving me your precious time and attention. Before I forget, please like, share, and subscribe to my channel.